New numbers show about half of San Diego County's coronavirus deaths are linked to congregate living facilities like nursing homes. And tonight, California advocates for nursing homes are urging the state to step up testing and enforcement of safety measures at those facilities. News 8 Lamore Abrams explains.
Seniors remain among the most vulnerable targets of this virus, but here in San Diego, advocates are so alarmed over the number of COVID cases linked to long-term care facilities that they are calling on the state to do a lot more.
We have all these so-called elected leaders. Where the hell are they?
3 months into the pandemic, Patricia McGinnis is losing patience.
Look, enough is enough. 40% of the people in nursing homes have died.
The founder of California's Advocates for Nursing Home Reform is even more startled by the tragedy in San Diego.
People think that elders are expendable because we're sure not treating them very well.
New data shows at least 108 of the county's 230 coronavirus deaths are at congregate living facilities like nursing homes. And McGinnis says there may be more we don't know about. That's because the numbers are self-reported, and she says go unchecked.
Until you have testing of every staff person and every resident in the nursing home, how are you going to know what the extent of this is?
California would need about 243,000 tests to check off every worker and resident in its roughly 1,200 nursing facilities.
Congregate living facilities is a priority.
The county says it's focusing on testing at hard-hit facilities, like the assisted living facility in La Mesa, with the second highest resident death toll in California. But across the country, at least 28,000 people connected to long-term care facilities have died. And in a recent interview with CBS News, the administrator for the Centers for Medicare and Medicaid Services responded to the oversight.
We've been going and doing inspections.
Inspections of those infection control policies patient advocates here maintain are simply non-existent.
You have to suffer with substandard care and then get sick and then die alone.
And we've put in requests with both the governor's office and the California Department of Public Health, asking them to outline exactly how the state is enforcing precautions being taken to prevent COVID-19 at long-term facilities. We have yet to hear back.
All right, Lamore, thanks. And the fear now is that thousands of California seniors who currently live at home will be forced into skilled nursing facilities due to Governor Newsom's latest proposed budget cuts. Just days ago, he slashed all funding to adult daycare centers, which care for seniors who live alone or whose family members work during the day. The Poway Adult Day Healthcare Center says 90% of its funding comes from the state.
The proposal that's on the table right now is just absolutely devastating. It will flood our nursing homes with so many more people. And we know that the nursing homes right now are the worst place someone can be because of the COVID pandemic that we're dealing with.
Adult daycare centers argue they actually save the state money by keeping people who rely on state assistance out of costly nursing facilities.